This is the Best Health Podcast, brought to you by Wake Forest Baptist Health in partnership with MedCost.
Good day, everyone. Welcome back to the latest episode of the Best Health Podcast from Wake Forest Baptist Health. I'm Justin Gomez. I am here with Dr. Cherrie Welch today. Welcome, Dr. Welch.
Thank you, Justin.
How's it going?
Great.
Good. So we are talking today, very important topic. Once again, it's a topic that we can spend a lot of time talking about, but we'll try and kind of narrow it down and just spend a few minutes talking about our brand new neonatal intensive care units and the care that we offer for premature babies and other babies and some of our tiniest patients that might have to spend some time in the NICU. And Dr. Welch is going to help us navigate through that process and maybe explain, how a parent might navigate through this process as well. So we're excited to learn a lot from Dr. Welch today. But before we get into that, Dr. Welch, you just start off by telling us a little bit about yourself, how long you've been here at Wake Forest Baptist, and how you got into medicine.
Well, that will take a long time. Well, I've been here for 17 years,
Okay.
and I've been the medical director of the NICU for about 13 years.
Okay.
And the medical director, basically what that is I'm involved in the operations of the NICU and basically making sure that we're providing the most evidence-based care based on the latest research and looking at the quality and safety of our care and continuously improving that.
Okay. So going a step further back, were you in college, high school, middle school, elementary school when you were like, hey, I'm going to be a doctor?
Actually, I was a junior in college.
Okay.
And
what got you interested in being in the medical field?
well, I'd never really thought about it before, and this is, again, a longer story, but one of those people that just comes into your life, actually a guy on an airplane that I just struck up a conversation with, said, you should be a doctor. It sounds like you're really smart and you make good grades, and it just sort of happened from there. I was already basically pre-med without having known it, since I was interested in science already. And so I looked into what I needed to do, and it was just taking the MCAT. And so I did pretty well on that and ended up getting admitted to Stanford Medical School. Nice. And finished up there and then came back to Chapel Hill. I'm from Charlotte originally, so came to Chapel Hill for a residency and fellowship. So a total of 10 years of training, and then finally got my real job here 17 years ago.
Well, there you go. You never know who you're going to sit next to on an airplane,
That's
I
right.
guess.
Exactly.
So just transitioning, maybe some people have heard about it. Hopefully some people have heard about it, but maybe some people have not. But here at Wake Forest Baptist Health, here in Winston-Salem, the campus, we have several hospitals all over Northwest North Carolina. But here in Winston, we just opened the new NICU. So if you wouldn't mind just talking to people for a brief moment and just tell them a little bit about the new NICU and what all it offers to some of our tiniest and cutest little patients.
Absolutely, yeah. So it's the state-of-the-art NICU, basically with a single family room design.
Okay.
Where families can be families in the NICU with their baby. And again, this is an intensive care unit, but we encourage the whole family to be here, and particularly the mom and dad, and they can spend the night with the baby and be involved in the care and interacting with the team and participate in decision-making and learning how to take care of their babies so that by the time they go home, they're fully comfortable and confident in doing that.
Sure. Okay. And there are 51 rooms here?
There are 53 beds.
53 beds.
51 rooms. We have 2 twin rooms, so 53 beds total.
Fantastic. And for anyone that might have to make a trip here to this campus, it's up on the 11th floor in the Ardmore Tower, and it is adjacent to our brand new labor and delivery units.
Yep, we're right across the hall.
Right across the hall, so that's very convenient. Kudos to whoever did the design and construction on that. Which is also has fantastic state-of-the-art amenities as well. So what I want to talk about now, Dr. Welch, is I'm assuming a fair percentage of the babies that have to come to the NICU for a little while are premature babies. So we've been talking and arguing and continue to talk and have some podcasts related to the mom, pregnancy, birthing, post-birth process. We're going to have several of these podcasts talking about a range of topics all in around moms and babies. When that obviously a lot of times a mom is not expecting to go into labor prematurely, and there's a number of factors that I'm sure can cause that to happen. So if a baby is premature, I guess talk about how y'all do an initial assessment of the baby and bring them up here to the NICU, and kind of what happens first when a baby first arrives at the NICU.
Well, first of all, we try and talk to the moms prior to birth because they're obviously pretty traumatized by what's about to happen and wondering, is their baby going to live and what's going to happen? What does this mean? Because like you said, a lot of times this is completely out of the blue, unexpected. And so we try and give them a little bit of heads up about what's about to rock their world and what to expect. And obviously that conversation is ongoing after birth and throughout the ensuing weeks and months. But we'll have a whole team that will come to the delivery room and be there right when the baby's born. And we have a nurse practitioner, respiratory therapist, and generally a physician, especially for the really tiny babies.
Sure.
We can take care of babies born down to 22 weeks gestation. Again, wow. 40 weeks is term, so just over halfway. And then our smallest baby that we've taken care of is about 12 ounces, so the size of a Coke can.
Goodness.
Yeah, so they're tiny. And so the limits beyond or being smaller than that, or just the equipment is just too big. Even that's about as small as we can go with our equipment.
Very interesting.
Yeah. So often the premature babies, especially born at the tiniest ones, their lungs are just very immature and they can't breathe very well just due to strength, but also brain maturity. Their brains just aren't reminding them to breathe constantly. And their lungs collapse because they don't have the proteins that keep our lungs open when we breathe all the air out. So their lungs will collapse at the end of their expiration.
Interesting.
So they often have to be on breathing support and breathing machines, sometimes for weeks and months.
Sure. So when the baby comes in and the initial assessment is done, I would think y'all would put together kind of a health plan for that baby, depending where they are in the premature range. If they're 3 or 4 weeks premature, 8 weeks premature, y'all kind of put together a plan of how to help move little baby along, correct?
Absolutely, yeah. In fact, for the tiniest babies, generally 26 weeks and under, we have what we call the golden hour and even the golden days. So the first 3 days of life are really critical in terms of keeping them warm and providing the respiratory support they need, but not giving too much that could actually injure their lungs, and then also just protecting their brains from any injury during that really vulnerable time. So yes, we pay a lot of attention to those tiniest babies because everything has to just be done very gently and very precisely. And then certainly for the babies born even bigger, we take them as they come, and sometimes they need some respiratory support and sometimes they don't. Sometimes they come out and they're breathing just fine and they just need to learn how to eat by bottle or breast, and oftentimes they can do all the things, but they're too little to keep themselves warm, so they just need an incubator for a little while. So as you alluded, they have different needs as they mature, and so when they're born at different gestational ages, we anticipate that they'll need less and less as they are born at more and more mature ages.
Sure. So what are some of the other common services that you might have to provide to these cute babies here in the NICU? As well as what are some of the common support services that you find yourself and your team supporting with the family of that baby? So what are the more common services, I guess, for lack of a better term, that y'all offer up here in the NICU?
Absolutely. As you've heard, to raise a child, it takes a village. And certainly in the NICU, it is a huge village of people that come together in a multidisciplinary team to look at every single organ system and every aspect of the baby. Okay. And so we have 3 teams now running simultaneously. And so on those teams, we have a nutritionist and a pharmacist that round with us every day. Okay. And then in addition to that, we have speech therapists who actually, obviously the babies aren't speaking, but they help with the feeding and the oral skills and bottle feeding of babies. And then occupational therapists who also help with positioning, physical therapists as well. And of course, all the lab personnel, the radiology personnel, and then all the subspecialists. So every specialist that you would see as an adult, cardiologist, pulmonologist, nephrologist, we have that in pediatric form. So we have pediatric subspecialists that come and help see these babies right from the get-go, can talk to the moms prenatally if there's some diagnosis that we know ahead of time that is going to require their services. And the nice thing about Brenner is that those subspecialists get to know these families and these babies in the NICU, and then they follow them throughout their childhood. So it starts right from the beginning.
Yeah, that makes sense. Well, that's very interesting. That team approach, that sounds really interesting. That's good information. I'm glad you're sharing that. So as the baby is making progress in the NICU, is y'all look for different milestones or benchmarks that baby needs to achieve before they can move along to the next phase to eventually, with the goal being discharged, correct?
Yes.
So as you're talking with mom and dad and the family, what are some of the milestones that y'all are looking for when a baby's here in the NICU?
Yes. So obviously the first few days, as I mentioned earlier, are the most critical. So getting through those first 3 days and surviving that is the first milestone.
Sure.
And then as babies get healthier and more mature and are growing, they need less and less machines. So initially you'll come into the room of a 24-week baby on day one, and there's all kinds of machines and beeping and pumps and things. And as time goes on, slowly those disappear from the room until there's just a nasal cannula perhaps and an incubator. And you've got mom in there and providing care for the baby. But ultimately the things the baby has to do before they go home are be able to keep themselves warm without an incubator. So just a blanket and a hat and a onesie, basically, just like you would have your newborn at home. They have to be breathing reliably, not having to be stimulated to breathe, because as I mentioned earlier, their brains sometimes aren't kicking in their respiratory drive, so they have to be over that, and that's a maturity related thing. Ideally they're off oxygen, but if they have to go home on oxygen, sometimes we'll send them home with nasal cannula oxygen. And then finally they have to be able to be bottle feeding or breastfeeding completely and gaining weight with that. And so those are the things. And then we can send babies are surviving and being discharged at smaller and smaller weights, but the car seats are a problem. So the car seats only currently go down to 4 pounds. So a baby has to be 4 pounds at least to be able to fit in a car seat to go home.
There you go. That's kind of a interesting logistical issue right there. Yes.
Yeah, we often have babies just waiting to get big enough to go home in their car seat, which is a challenge because they're here in an ICU and they could be at home if we just had a better car seat.
Yeah, interesting. So, if I have 2 sons, and neither of them were preemies, and fortunately, they did not have to spend any time in the NICU. But when I would think through just personally, probably, and maybe some other parents have this similar thought process. When I have this preemie baby, there's maybe a little bit more hesitation, or there's barriers there that, is the baby strong enough for me to carry this way? How do I carry how do I dress the baby more carefully? So, do y'all kind of go through that with the parents and the family of when the baby's, getting closer to discharge, kind of how to care for a preemie baby? Are there any, special circumstances that you all talk to the parents about before the baby goes home?
Not really. By the time they're ready to go home from the NICU, ideally, for the most part, they should be treated just like any other newborn baby going home. Obviously, with any newborn baby, you don't want them to be around anybody who's got a virus or is sick in any way, because that could, especially for premature babies, it's more serious. But for any baby, you wouldn't voluntarily put them in contact with somebody who's sick.
Yes.
So we try to counsel them about that. But babies in general, and especially NICU babies who have been through weeks of NICU survival, they're pretty resilient. So they're a lot tougher than you would think. And we don't want parents to get into the mode of thinking of their child as extra vulnerable. So it's called the vulnerable child syndrome, where they keep them from doing activities even throughout their childhood because they were born premature. But whatever they can do, they should be able to do. Just just like always, you don't need to protect them in any other way except from infections in the first couple years of life.
That's very good information. So we here at Wake Forest Baptist Health, the NICU is a Level IV NICU, and I think that sets us apart from other NICUs around the region. Can you talk to us a little bit about kind of what the difference is and why that sets us apart, and some other differentiators here at Wake Forest Baptist of what that means as far as capabilities or services?
Absolutely. So Level 4 NICU means that we can provide care all the way for the tiniest of babies, all the way through any surgery that they might need,
Gotcha.
including cardiac surgery.
Gotcha.
And so we perform cardiac surgery on children, some neonates, but definitely on older children and babies as well.
Okay. So what is some encouragement or advice you could give for, if a mom is pregnant, there's a million thoughts that go through her head, and, a lot of them say, might have family members that have had preemie babies or anything. So, you get to talk to a lot of parents and have talked to a lot of parents. So, what words of encouragement or reminders do you offer to them when their baby is here in the NICU and to help them get through the journey?
Yeah, the parents are very scared about what's happening and what this means for them. And one of their questions is, how do I be a parent in this environment? I had all these thoughts and these ideas about what I was going to do when I first saw my baby and held my baby, and now this is way different from what I thought. So how do I transition what the ideal was to this new reality? And there's lots of things that parents can do. They can, for one, moms providing their own milk is so important. It's the absolute best food that we can give babies. Formula is not, it's made from cow's milk, and it's just not what our bodies are meant to have. We do have donor milk, but it's for the tiniest of babies. But mom's milk is absolutely the best for her baby, and that's something that none of the rest of us can do. Only the mom can. So that is a huge part of being a parent in the NICU for a mom, is to pump her milk if she can. Now some moms can't, and that's okay. We can work around that. But
sure.
But that's huge. And then just being here and being involved and learning about their baby and being an expert on their baby. We are experts in neonatology, but these parents are experts in their baby, and they can tell us a lot about how they think their baby's doing, and that's very valuable information for us. And also just trusting and forming relationships with the caregivers and realizing that we're all on the same team and trying to move things forward. And sometimes it gets frustrating because things aren't going your way, but we're all on the same team, and we want what's best, and we want your baby to go home as soon as possible, as safely as possible.
Sure. That's really interesting, Dr. Welch. So we'll be wrapping up in just a second here. But before we do, I wanted to touch on any, once the baby gets discharged, like you mentioned earlier, they should be at a level where they should be able to continue care with a pediatrician at their pediatrician of choice. That's correct. Just
correct,
with normal follow-up
absolutely.
appointments as a non-preemie baby would.
Yes, in addition to whatever subspecialty care appointments they would need, the pediatrician is still their quarterback for their care, and will continue on with all the vaccines and the normal regular childhood things.
Gotcha. Well, Dr. Welch, I appreciate you taking the time today. This has been super helpful and informative. Hopefully, parents out there or soon-to-be parents will find this information helpful. Just talking about the NICU and premature baby process. If someone does have to visit the NICU, and rest assured that our experts here at Wake Forest Baptist Health can help your family and your baby get back to being healthy and being at home. I'm sure that's the end goal for all the babies here visiting NICU is get them back home with the family, right?
Absolutely. We love to wave goodbye as they're going out the door, and we love when they come back and visit us when they're back for their subspecialty appointments and running up and down the hall, and it's just really exciting. That's what we do this for.
Yeah, I bet that's precious. And I bet it's fun to even see as they get ready for discharge, their little personalities develop.
Yes, indeed. Yeah, and just to see the parents and how far they've come from the beginning as well.
Yeah, that's great. Well, just to offer up everyone, if you want more information about the services we offer for babies and the NICU, just go to wakehealth.edu, and then there's a search bar. You can search NICU. You can search the birth center as well. There's information about that, the new birthing center on the website as well. Or you can always call 336-716-WAKE, and if you need an appointment or someone in your family needs an appointment, they can get you taken care of. So I appreciate everyone listening. Dr. Welch, thank you once again. This has been fantastic.
My pleasure.
And we will catch you on the next episode. Have a great day, everyone.
Thanks for listening to this episode of the Best Health Podcast, brought to you by Wake Forest Baptist Health. For more wellness info, check out wakehealth.edu and follow us on social media. Wake Forest Baptist Health, the gold standard of healthcare.